Hello, I'm Morgan Young, and this is my Cadaver Lab project video. So, for some background information on the donor that I chose, he was a 99-year-old male who died of acute and chronic respiratory failure. We noticed when we were getting all of our information that his heart was on the larger side and with a noticeably enlarged aorta. And he also had an enlarged thyroid, which possibly could have been a goiter. But besides that, he seemed to be pretty healthy. He had very little body fat, adipose tissue on him, especially compared to the other donor that we looked at that day. But especially for being a 99-year-old, he seemed pretty healthy, and those were all the issues that we found. Some expected medications for respiratory failure that this donor may have been on include antibiotics for infection, corticosteroids for an inflamed airway, or bronchodilators to help open up his airway. He also may have been on blood thinners, especially if he was in the hospital for a super long time. And then for hyperthyroidism, if he did have hyperthyroidism, some medications could include radioactive iodine and methimazole. We don't for sure know if he did in fact have hyperthyroidism. That just could have been the anatomy of his body having a bigger thyroid gland, but yes. And for health history, this donor could potentially have had a history of high blood pressure, a high heart rate, and a history of hyperthyroidism due to that enlarged thyroid gland that he had. For interdisciplinary consults, definitely be in touch with the respiratory therapist to help aid in oxygen therapy and breathing treatments, physical therapy to determine the patient's strengths and weaknesses when it comes to how much stress and exertion he can really put on his body, especially with his old age and being in respiratory failure. OT to determine how well he can carry out his ADLs with having this chronic disease, and then also a pulmonary specialist and an intensivist. Some safety concerns for this patient in respiratory failure include oxygenation monitoring, big fall risk, especially for his age, nutrition imbalances, and if he was properly hydrated and taking his medications properly, especially if he had that history of hyperthyroidism. And older patients always tend to have issues with nutrition and staying hydrated to begin with. So those would definitely be some big safety concerns when it comes to this donor. Some nursing care for a patient in respiratory therapy include maintaining a patent airway, evaluating ABGs, appropriate oxygenation, positioning of the patient, sitting them up, having the head of the bed elevated at the appropriate time, ventilator care, oral care, preventing ventilator-acquired pneumonia if he was ever intubated at any point, providing adequate nutrition like I had already talked about, and then just overall, when it comes to nursing care, just educating him on his disease process and making sure that he understands the why behind all the medications that he's taking and all the procedures that he's undergoing, because it's confusing and a lot for patients who just had all of these big medical terms and things going on with them that they don't understand. So education is important. And then some nursing care for a patient who, if he did have hyperthyroidism, would include continuing that education, but specifically for avoiding caffeine and stimulants, because that could potentially make any symptoms worse, such as adding to the high blood pressure and the high heart rate. And then another thing when it comes to nursing care, if he did have hyperthyroidism, would be monitoring his appetite and weight. But yes, and thank you.